Welcome to the show. I'm Kathy Ireland. Modern medicine has made incredible advances in recent years, and this is especially true of autologous therapies that use a patient's own cells to help their bodies heal. Patrick Penny, Chairman and CEO of EmCyte Corporation, joins us today to talk about how his company is achieving a new standard in regenerative medicine. Welcome, Patrick.
Kathy, thanks for having me.
Patrick, EmCyte Corporation specializes in autologous regenerative biologics. Can you tell us about this exciting field?
Kathy, I've been doing this for 20 years, and I'm still amazed every time I talk about this. I mean, the idea of using a concentrated form of autologous growth factors and progenitor stem cells for targeted wound healing is an amazing concept. It's not just reparative, it's regenerative, and the healing continues long after the procedure has been completed. It's changed the lives of millions of people around the world, giving them a treatment option that they otherwise would not have had. And quite frankly, it's affordable, oftentimes less expensive than the deductible for a surgical procedure. So it's a fantastic procedure, and I'm really energized, and it's been a fantastic journey for me as a pioneer in this industry, and I'm really honored to be in the position that I am.
Patrick, what are some of the medical conditions that respond well to this type of treatment?
Well, we find this to be used for things such as skin rejuvenation, as it helps hydrate the skin, helps deal with fine lines and build collagen. We also find it used for hair restoration, as it helps stimulate the hair follicles. As we first started with this treatment, we find that it works very well for chronic non-healing wounds, as it helps revascularize a wound bed and through a process we call angiogenesis. It's also used for men's and women's wellness in dealing with conditions such as erectile dysfunction and incontinence. And we've seen it also used for pain management, as it deals with chronic pain, essentially chronic back pain. However, but we like to talk about the orthopedic and sport medicine use of this product, as we find it to be very effective for conditions involving bone, and muscle, and tendon, ligament, and cartilage. So we're really talking about connective tissue tears or injuries or chronic joint conditions. So ultimately, a physician will make that determination as to what biologic to use and how much of that biologic to use, depending on the pathology that's presented to them.
EmCyte was the first company to introduce pure biological systems, meaning no red blood cell contamination and no harmful white blood cells. In other words, the painful derivatives and the injectables are eliminated, and that's a good thing for patients.
In 2009, when we first started using platelet-rich plasma for tendinitis, tendinosis, and bursitis, it was a slam dunk because it worked almost every time. But it wasn't long before we expanded its use to osteoarthritis. And slightly more complex cellular therapies for use of osteoarthritis became a mainstay of what we do. It's kind of our bread and butter now for cellular therapies. And those patients do very well. They send in their family and friends, and we're very happy with the outcomes that produces.
So EmCyte Corporation is known as a producer for biologics. For many, many years it has been the market leader. Now, by adding a new primary focus to the company, being education, we feel we're gonna bring a totally new concept of care to physicians, other healthcare providers, by not only teaching us how to prepare biological products, but also how to implement them in their daily practice by having precision medicine in place, carefully monitored by quality management, by instructors that have experience in this field for many, many years.
The procedure we're performing today is very similar to something we use commonly for platelet-rich plasma. It's a mid-50s gentleman who has osteoarthritis of the knee, had great success at treating these people with cellular therapies. So we're going to draw some blood, centrifuge it down, collect out the platelets, and inject a platelet-rich plasma solution into his knee under fluoroscopic control to make sure it is in exactly the right spot. The EmCyte product that we use concentrates the platelets. Now the platelets are the healing portion of your blood. So the EmCyte product is a way that we can process standard blood into a product which is just the plasma and a very high concentration of platelets within it. After having used almost every product out there, we just keep coming back to EmCyte. It seems to be safer because there's less handling of the product, therefore there's a lower chance for contamination. The products just keep evolving as the science evolves. So they just give us a better product with a better outcome, and we think part of that outcome is the fact that we have a more consistent platelet-rich plasma sample that we get out of every product that we produce. The cellular therapies that we've been doing, including platelet-rich plasma, have been very successful at treating particularly bursitis, tendinitis, and osteoarthritis, but mostly osteoarthritis of the knee where we've had our greatest success. Patients like it because they come back with less stiffness, less pain, less swelling. When we have about an 80% success rate at getting about 80% improvement, as long as people aren't truly end-stage bone-on-bone with deformity.
How does EmCyte support autologous regenerative treatments?
Well, we're more than supporters of these treatments. We're innovators of treatments and protocols. So with the good work of our Chief Scientific Officer and our key opinion leaders, we've been able to conduct a host of clinical trials and research projects. And from these projects, we've been able to collect good evidence-based information that allow us to develop better treatment methodologies that are more clinically effective for a patient. And from a scientific perspective, we've been able to look at our biologics and look at the good and the bad components of our biologics and refine our products so that we're collecting just about all of the good while eliminating just about all of the bad. We find it to be an important distinction because we're going one step further to not only ensure that our products are clinically effective, but also well tolerated by the patient. So patients respond with faster healing, with less pain, less inflammation, and less discomfort.
Patrick, your company recently broke ground on an educational institute. Can you tell us more about this exciting project?
Yeah, we're talking about Gulf Coast Biologics Training Center. We're really excited about this project here. We believe that training and education and research and collaboration and peer reviews are some of the good things that are needed to continue the good work in regenerative medicine. So our key opinion leaders, they come together to share their experiences and their expertise and educate our medical practitioners and the general public and help build awareness and really have a positive impact in the field. Our training center itself will have beautiful chandeliers and recessed lighting and glass entryways and large treatment rooms, also that our attendees can have a substantive yet enjoyable experience. We intend to house up to 100 attendees, and we're looking to do anywhere between 6 and 12 conferences annually.
Excellent. Patrick, what do you find most rewarding about the work that you do?
Well, I've started this from a clinical perspective, and clinical outcomes are what motivates me. I'm energized every time a patient expresses how these products have changed their lives. And being a recipient of these autologous biologics myself, I can relate to the elation and joy that a patient feels every time they use these products and is made a change in their lives. So as long as patients continue to respond to these products and continue to have a positive outcome, I will continue to be motivated to do what I'm doing.
Oh, congratulations. And what does the future hold for EmCyte Corporation?
Well, I think we're going to stay the course. There's still a lot of training and education to be done, and we're going to continue to build awareness and engage the general public and have them get more involved in their treatments with physicians and have them understand the differences in these biologics. And really, we're going to look to hold our physicians accountable and have them realize that a $10 or $20 savings is not worth it when you're comparing a biologic that has no active ingredient to a biologic that's powerful and proven to be clinical. So we'll continue to do what we do, and from the very beginning, we started this from a patient perspective, and we'll always maintain a patient-first mindset.
Right. Well, Patrick, it sounds like EmCyte Corporation provides innovative medical devices to enhance regenerative therapies. Congratulations, and thank you for joining us.
Thanks for having me.
Thank you. And thank you for watching. I'm Kathy Ireland.